Welcome to Medicare 360. I'm your host, Jennifer Lee, where we simplify health insurance so you can make confident decisions for you and your family. Today, we're going to talk about something that affects millions of Americans, especially those not yet on Medicare. We're going to discuss the Affordable Care Act, also known as Obamacare, also known as Covered California in the state of California. We'll discuss who qualifies, why some people pay very little and others pay a lot, and what changes are happening as we move toward 2026. Even if you're already on Medicare, this episode matters because many listeners have spouses under 65, adult children, early retirement plans, or clients transitioning between coverage. So today is about understanding the bridge between employer insurance and Medicare. So let's talk about the backstory, why ACA, Affordable Care Act, was created. Let's rewind. Before the Affordable Care Act was passed in 2010, health insurance worked very differently. Insurance company could deny coverage for pre-existing conditions, charge higher premiums based on health history, decline people entirely, or rescind your coverage after diagnosis. So someone had cancer, diabetes, or even asthma, getting coverage could be extremely difficult. And that's why till this day, clients do ask me, oh, do I have to qualify for underwriting with, coverage below 65? And I absolutely say, no, you do not. But because before 2010, insurance companies could technically deny pre-existing conditions. So the goal of the Affordable Care Act was very simple: make health insurance accessible regardless of health status. So that definitely helps people. So the key changes include guaranteed issue coverage, essential health benefits, income-based subsidies, and expansion of preventive care. Each state has its own marketplace. So, like I had mentioned, here in California, the marketplace is called Covered California. So, what is Covered California? Covered California is not an insurance company. It is a state marketplace where individuals and families can shop for health plans. Private carriers can still provide the insurance, such as like Kaiser Permanente, Blue Shield of California, Anthem Blue Cross, or HealthNet. Just to name a few, but I would say those are the bigger ones that we do have in more of the, I would say, the city area, the metropolitan areas of California. So Covered California determines your eligibility, your subsidies, your income verification, and enrollment periods. So let me dig deep a little bit on that. So eligibility is basically, I would say, if you are paying your taxes, you're able to actually get coverage. But of course, there are enrollment periods, right? You just can't get it at any time you choose. So there are enrollment periods, ones such as, you leaving work, that counts, or just the yearly enrollment as well. Subsidies also come into play, and I will go over that in a little bit more detail. And then income verifications, that has to do with the subsidies as well. So think of it as like a shopping exchange with financial assistance, okay? And of course, sometimes people don't qualify for it as well. So let's talk about how the subsidies work, which I think is probably the most misunderstood part. Monthly premiums are based largely on household income, family size, age, and zip code. So the government provides premium tax credits called the subsidies. So the income fails within certain ranges. The government pays part of the premium directly to the insurance company. So let's go over this in a little bit more detail. So your premium is going to be based on your household income. And this is the adjusted gross income of your household. How do we figure out household? It's how you file your taxes. Are you single? Are you married, filing jointly? Do you have dependents? The biggest thing in regards to the household income is if you are not filing jointly and you are married, you will not get a subsidy because let's just say in the government's eyes, you should be filing together instead of filing separately and getting more subsidies. Okay, so also we take a look at your family size. So the higher your family size, the more income that you could make to fall for the subsidies. And if you need the chart or the table, we could definitely send that to you. So we take a look at your age, right? And then your zip code. So let's take an example of a couple age 62 earning moderate income pay. Their monthly premium is about $200 to $400 per month. Without the subsidy, the same plan could cost $1,500 plus a month. So the important clarification is here is subsidies are advanced tax credits. They reconcile when taxes are filed. Okay. So if income is underestimated, some subsidies may need to be repaid. And if income is lower than expected, additional credit may be received. So let me go over that again. So whatever you put on your application, let's just take an example of, let's say you have a household income of $50,000 for you, your spouse, and your dependent kid. Okay, so $50,000, household of 3. So let's just say come tax time, when you do your taxes, you actually made double than 50,000. You made 100,000. So that would mean when you file your taxes, you will most probably have to repay those tax credits or that subsidy that the government gave you, right? Because you weren't making 50,000, you were making 100,000. And that goes vice versa as well. Let's just say when you come file taxes, let's just say your hours got cut and you made 25,000, and let's just say your spouse quit working. However, so let's just say income just cut in half. Then you're able to get tax credits or even more for the subsidy. So you would be paying less premium on that. So you would get money back. We do recommend to have a really good estimate. And if your income does change, increases or decreases, to make sure to update your file on the system, because you don't want to have major big surprises with a big tax bill or paying too much when you shouldn't have. So that's key there. We do help with that as well. So let's go over some more case studies. Let's just say you retired early. So it's like that early retirement bridge, right? You're not quite Medicare age at 65 and you retire at 63. So let's just say your employer COBRA cost is $1,900 per month. Covered California plan after the subsidy could be $420 per month. But I mean, it really depends on your household income, adjusted gross household income, and that is based on that current tax year. Because you know how Medicare, they look at your premium and they determine it based on your income 2 years ago. This one is they are basing it on that year. Okay, so also keep in mind that let's just say Cobra was really cheap, like it cost you $100. That doesn't really happen very often. But just know when you do turn 65, Cobra is not credible coverage and you do have to get on Medicare. Okay, so that's the biggest thing. I see this more often when a spouse quits working, retires early, but they have the other spouse who is not 65 yet, that needs coverage, even if that person's turning 65. So there's different scenarios, and we definitely could help you with that. So another example would be a self-employed couple estimated income too low. Okay, so it's like the income surprise. They exceeded the subsidy limit, so they had to pay 4,000. So that's the biggest thing, right? You got to always update your income changes during the year, throughout the year. If you know you're going to have a major spike or major decrease, it is just best to update, unless you're just, hey, you know what? I am okay paying with the credit at the end of the year or paying more, right? So it is going to be a preference, but typically you do want to just stay within those limits as close as your estimates. You're not paying too much or too little. Okay. So let's go over another case. The husband turns 65 and moves to Medicare. The wife is age 61 and needs coverage. So Covered California is allowed to get coverage, right? Because one spouse is going on Medicare, the other one still needs coverage. So it is a separate eligibility, and the coverage is still subsidized because you're still filing joint, right? The only reason why it wouldn't work is if you're filing separately. That's when you do not get a subsidy. So please keep that in mind. That is extremely important to know that, because maybe you want to change your filing status that year, or just know you are not going to get a subsidy on it. Okay. So what does the ACA plan cover? All ACA plans must include essential health benefits. That's doctor visits, hospitalization, emergency care, prescription drugs, mental health services, preventive screenings, maternity care, pediatric services. And some plans are categorized into metal tiers. I would say the pediatric services, the neat thing is that your dependents, your minors, they do get dental coverage at zero cost. It's like embedded in it, which is pretty nice because you as an adult or as an individual has to purchase separate dental coverage if needed. So it's kind of like a nice plus. I would say sometimes clients say, you know what, I'm not going to qualify for a subsidy. I make too much income, which is fine. And you could definitely go to the carrier directly, or of course use us as a broker to help you with that. But sometimes, I mean, you save $1 on Covered California, even though your limits are high. And then if you do have children, then with Covered California, you do get that free dental for the kids. Okay, so let's go over the plan categories into metal tiers. So the bronze is going to have the lowest premiums and the higher deductibles. Silver is going to have a balanced coverage, just like midpoint, okay? Has enhanced of subsidies. You're paying medium pricing with better coverage. Okay, so there's gold, which is higher premiums and lower out-of-pocket cost, right? So this is if you know you're having surgeries or you're just, going to the hospital and the doctor's in and out. It may warrant you to get a gold plan, or even less common is platinum, right? Which is highest premiums and lowest cost sharing. So if there's time, I'll deep dive in that. But if not, I will save that for the next show. So let's talk about the common mistakes people make. Mistake number one, missing open enrollment. So it's typically November through January. Outside this window requires a qualifying event such as moving or changing jobs, losing your health insurance. So the biggest thing is, I would say Covered California has been lax the past couple years during COVID and so forth, but they are requiring proof. So they need proof that you actually had a qualifying event. So mistake number two, which I harped on so much, is not reporting income changes. This could create tax penalties or repayments, and some people just, can't even afford that. So please make sure to update your income. So mistake number three, and let me go over the mistake number two. Sometimes you will meet maybe an unethical agent that's looking for a sale. So giving you the lowest premium, but you don't know that the income they put was like way lower than your real income. And then you would have a tax burden or repayment when you do taxes. So keep that in mind. Sometimes, agents could make an error. So just make sure it's correct. So mistake number three is assuming all doctors are included. So ACA plans are network-based. Some are HMO, some are EPO. Very limited on EPO now. I've just seen more HMOs, and then some limited PPO availability. So always confirm provider participation. Unfortunately, nowadays, there are a lot of contract changes with medical groups and hospitals. So it's always good to keep abreast of these changes or updates. Take the calls of your medical group and your doctors or your broker because they are well aware. They should be well aware of these changes. So mistake number four is confusing ACA with Medicare. So ACA ends once Medicare eligibility begins. You generally should not keep subsidized ACA once eligible for Medicare. So number one thing is Covered California or ACA is not credible coverage. So when you do turn 65, you do have to get on Medicare. If you do not, you will be penalized 10% for every single year that you did not get on Medicare. Then also that 1% penalty per month if you don't have a drug plan, a Medicare eligible drug plan. So this is a thing. Some clients tell me, Jennifer, my premium on Covered California is very low. It's like $5. I don't want to get on Medicare. The Part B premiums are higher, right? So unfortunately, you do have to bite the bullet. However, we could help assist you and find you maybe premiums that could help you out in getting into Medicare. So of course, we could help you with that. So changes and updates heading into 2026. The key trends we're seeing is expanded subsidies continue helping middle income households. And I would say the biggest thing is on this, it was a big deal, right? Premiums have definitely increased. Subsidies have definitely decrease, and really they're just setting the baseline from pre-COVID days. When COVID happened, there was just more subsidies, just more help. Now we're slowly transitioning back to stabilizing, but people are looking at it as oh my gosh, it is not good. It is not good, but however, it is just stabilizing. So more early retirees are using ACA as a transition to Medicare. What else can you do, right? Well, some people don't get coverage, but that's tough. Something catastrophic happens, but we could definitely help you on that as well. So increased focus on preventive and virtual care. That's like a big thing, right? Because the more healthy you are, the less you'll go to the hospital and the doctor. Narrow provider networks in some regions. So like I mentioned, medical groups, insurance companies, they are in contractual mode, contracts are expiring and they have to negotiate, right? So that's just a big disruption in the industry today. And then premium adjustments tied to healthcare inflation. Unfortunately, this is the case with the rising healthcare insurance costs. So one major shift is people are planning retirement timelines around ACA affordability. So I think that's a big thing. If you are thinking of retiring in your 60s, your healthcare is really expensive, thousands of dollars, right? And if you have a spouse, and then like if you have dependents, so those are things to keep in mind, and we could definitely help you plan for that and see what would be the right age to retire, and then do the calculations in regards to affordability and just timing of everything. And a lot of people ask, like, when can I get coverage? Technically, you could get coverage that last day of the month for an effective date, the first of the following month, right? Of course, with a qualified event. Okay. So healthcare strategy now affects retirement planning more than ever. This is what we're here for, to make sure that you are well aware of how everything works and just educating you on just all your options. I know. So if there is one takeaway from today's show, it's this. The Affordable Care Act was designed to create a pathway to coverage, especially between working years and Medicare. And we're able to help assist you with this. All we need is your ages, your adjusted gross income, and your zip code to help you find all your options and your needs. For many families, Covered California is a safety net, right? A retirement bridge or protection during life transactions. And some people, like, it's just so unaffordable. They are leaning towards catastrophic coverage, which, I mean, if that's the only thing you could afford, or you're not willing to pay the premiums on healthcare, then something is better than nothing. And that's something we could also help you with as well. But it's definitely good to understand the income rules, because that hurts people a lot. The enrollment timings, right? Like if you're just off a day, and how the plans are structured, right? Just knowing like your deductibles, your co-pays, your co-insurance, your preventive care, and how everything works. Something that's popular is a health savings account with high deductible plans. I think more and more people are leaning into that, looking into that. And of course, if you have any questions on that, we could definitely help you with that as well. So at Medicare 360, education comes first, helping families understand ACA, employer coverage, and Medicare all fit together. We often even help clients with their employer coverage, just letting them know how it works if needed, comparing it with the ACA and Medicare as a whole as well. So thank you for spending this time with me. My name again is Jennifer Lee, the host of Medicare 360, where clarity always comes before coverage. I look forward to our show next week. Have a wonderful day.